CNA Practice Test 2026 Certified Nursing Assistant Legal Nurse Aide Exam Questions and Answers. Question 1. What does HIPAA protect? Employee salaries, patient health information privacy, hospital equipment, nurse schedules. HIPAA ensures the confidentiality of protected health information, FI. Question 2. A resident refuses a bath. What should you do? Force them to bathe. Respect their refusal and report to the nurse. Call their family. Tell them they smell. Residents have the right to refuse treatment. Question 3. What is an example of negligence? Performing a task correctly, forgetting to lock bed wheels and a resident falls, reporting a change in condition, asking for help. Negligence is failure to provide expected care, resulting in injury. Question 4. A CNA sees another staff member hitting a resident. This is slight misconduct, physical abuse. Okay if the resident was combative. None of your business. Physical abuse is intentional harm and must be reported immediately. Question 5. Who is the ombudsman? The facility manager, a legal advocate for residents, a doctor, the head nurse. An ombudsman investigates complaints and advocates for residents' rights. Question 6. Which of the following is a resident's right? Having their mail opened by staff, choosing their own clothing, being restrained for staff convenience, never being allowed to leave. The Resident Bill of Rights includes the right to make personal choices. Question 7. A CNA tells a resident they will skip lunch if they don't behave. This is discipline, psychological abuse, effective management, negligence. Threatening a resident is a form of verbal/psychological abuse. Question 8. Invasion of privacy occurs when you knock before entering, you close the curtain during a bath, you read a resident's mail without permission, you check their ID band. Privacy includes personal space, mail, and body during care. Question 9. What should you do if you suspect a resident is being abused? Wait for proof. Report it immediately to your supervisor. Ask the resident if they are being abused. Tell the abuser to stop. CNAs are mandated reporters and must report suspicions immediately. Question 10. The Resident Bill of Rights was established by OBRA, HIPAA, the local police, the hospital board. The Omnibus Budget Reconciliation Act, OBRA, defined resident rights. Question 11. Informing the nurse about a resident's wish to vote is supporting which right? Right to free speech, right to participate in their own care, right to exercise their citizenship, right to privacy. Residents retain their civil rights, including the right to vote. Question 12. When can a resident's private information be shared? With your friends, with staff directly involved in the resident's care, with the resident's neighbors, on social media. Information is only shared on a need-to-know basis for care. Question 13. What is involuntary seclusion? Allowing a resident to stay in their room, isolating a resident against their will as punishment, protecting a resident from infection, closing a door for privacy. Separating a resident from others against their will is a form of abuse. Question 14. A CNA gives a resident's bank details to a friend. This is financial abuse, kindness, helping the friend, standard procedure. Unauthorized use of a resident's funds or property is financial exploitation. Question 15. False imprisonment is restraining a resident without medical necessity, putting a resident in their room, escorting a resident to a dining room, locking the facility doors at night. Unlawful restraint of a person's freedom of movement is false imprisonment. Question 16. Ethics are laws passed by the government, knowledge of right and wrong, workplace rules, the resident's preferences. Ethics guide behavior based on moral principles. Question 17. Which of the following maintains a resident's dignity? Calling them sweetie, leaving the door open during toileting, using their preferred name, talking about them as if they aren't there. Respectful addressing and involving the resident maintains dignity. Question 18. A resident wants to see their medical record. You should give it to them, tell them it's secret, report the request to the nurse, tell them they are too old to understand. Residents have the right to see their records, but the process is managed by the nurse/admin. Question 19. What is assault? Hitting a person, threatening to touch a person without consent, performing a procedure correctly, ignoring a person. Assault is the threat of harm, battery is the actual touch. Question 20. Misappropriation of property means finding a lost item, stealing or misusing a resident's belongings, moving furniture, cleaning a room. It is the illegal or improper use of a resident's money or assets.